Thank you, Madam Chair. I rise today in strong support of this life-saving amendment, which would reinstate the pro-life policies this committee has long supported and which a majority of Americans still support. Madam Chair, for years the Appropriations Committee has kept this non-controversial pro-life provisions intact without poison pills that would knowingly delay funding for the federal government. Unfortunately, those long-standing bipartisan provisions have been stripped from this bill, and we have before the bill that we have before us today. And those stripped provisions include the Hyde Amendment, which bars the use of federal taxpayer funds to subsidize abortion except in cases of rape, incest, or to save the life of the mother. And the Weldon Amendment, which safeguards the conscious protections of medical professionals who may have a religious or moral objection to performing abortions. For years, these amendments have saved countless lives from abortion killings while ensuring taxpayer funds aren't used to cover the cost of those killings. And they are killings, Madam Chair. The only difference in the act, whether it's in the womb or it's at First and Main Street, the only difference there is geography. The act is the same. The life of an unborn baby is sacred and precious. And regardless of your political affiliation, it is unconscionable to strip these protections. As a law enforcement officer, I've dedicated my entire life to fighting for those who are unable to fight for themselves. I continue to do so in my role in Congress. And my Republican colleagues and I are not the only ones who feel this way, Madam Chair. In fact, a 2021 Marist poll that was referred to earlier found that 3 out of 4 Americans, even those who identify as pro-choice, want significant restrictions on abortions. And folks, this is not complicated. Abortion is not, as was suggested earlier, abortion is not health care. Health care is a means by which we save lives. Abortion kills a life. It's not health care. Even if you support the right to an abortion, this amendment would not ban all abortions, and that is an entirely separate issue. Instead, it would simply maintain those common sense guardrails on abortion services, number 1, to protect taxpayer funding, and number 2, to protect the conscience rights of healthcare providers. I'm proud to support this amendment and urge all my colleagues, no matter your position on abortion, to look at the big picture here. The American people do not want this, and our medical community does not want this, and it's time that we listen to them to respect their wishes and pass this amendment. I strongly urge passage of this amendment, Madam Chair.